this is where it would be. I'm gonna take it up, and the first thing I need to do is really open it up. If you notice, there is, in fact, you can't even see it really, but there's a metal band under here. This metal band, I'll explain the use of it in a minute, but the one thing you wanna do is unfold it so that it's as straight as it can be. And you don't have to be, like, have to like iron it. You just wanna make sure it's not like, just bent. So see, I'm just opening it here, all right? Now, I'm going to be ready to go ahead and put this on the sterile field. This is what we're going to be saying. This is going to be a patient who's going to have a surgical procedure, a laminectomy, and so I'm going to pretend instead of them being, supine, they're gonna be prone, so their head's down, faces down, and so I'm going to pretend that my surgical site is right here, okay? In order to know what side of the patient this goes on, I need to know what side the C-arm is going to be coming in on, because it's the side opposite to where the C-arm is coming in, because remember, I'm covering the bottom of the C-arm. So I'm pretending now this is my C-arm here, and that during the case is going to come in, and so when they go from AP to lateral, this bottom of the C-arm is going to come up here, all right? So this is why I want to put this here.
Sure.
Brad, if you could do me a favor?
Yes, ma'am.
If you would take, see the paper?
Yes, ma'am.
If you would take it off there, and if you'll notice, he took the paper, there's adhesive strip, there's a wide adhesive strip, and sorry, I should not have done that. There's a wide adhesive strip here that's very, very sticky. But on the side, on these sides here, either side, there's also an adhesive strip covered by paper. The most common complaint we hear is that they say, oh, the sides don't stick. And we say, did you take off the paper? Oh, I forgot. I did an in-service yesterday in an account who told me, we don't need an in-service. We have used this forever. And I said, and I got to that part and the woman said, I never even knew they were there. And I'm going, see, you learned something. So what you want to do, and it's usually going to be either the surgeon or his assistant is going to be placing this, but you want to have this above the surgical field boundary, and as close to the surgical site as possible, but without being in the way of the surgical site, okay? That's why it's important for them to put it on so they know where to go. And if you notice, in the middle here is a little white piece of Velcro. Can you see that? In the very middle? See here, there's a piece of Velcro. You want to have that piece of Velcro in the middle of the surgical site on the side, so that this way it's, you're centering it. So I'm going to pretend right here is my surgical site, and this is going to be interesting. And I'm going to go ahead and put this up top, okay? And I want to make sure that I go ahead and make sure that adhesive adheres all the way down and that it goes down to the side. All right? So this is good to go. Thank you. And then all of this folds down. Now, this is a little, in most cases, you're not going to have the armrest here, so we're just going to pretend it's not there. So now we're doing the case, okay? The surgeon has gone ahead, he's trying to find out what level he's at, or they're going to be, looking at, okay, they put in some screws, or they're about to put in screws, and they want to check everything. So now the C-arm is going to come in. The top of it will be covered with a C-arm drape, and now my C-armor will be put into action, okay? So as the C-arm is now being rotated from AP to lateral, what we're going to do is we're going to take this is Velcroed on, and what you'll do is just take it like this and pull it out, okay? Now, as the bottom of the C-arm comes up, it's going to be put in the middle of this pocket, all right? If you see this band, if you notice this band keeps this straight so it doesn't droop down and become contaminated. So that's the purpose of this metal band. So now you've got your C-arm up. Now we're finished. They've done, they've gone ahead and taken their shots. They know that they have all the knowledge they need. And so now you're going to put it back. And what they'll do is go ahead and take this, and you're going to reattach, just using the Velcro. Okay?
Cool.
This can be used multiple times. There's no limit to the number of times that this can be used in a case. You can use it 5 times, you can use it 20 times. So that's what makes it cost effective here, is because you're not having to open up and use a half sheet or a 3/4 sheet or a mayo cover, because if you're using it now, that gets thrown away. So that cost is thrown away. So with this, you have one drape that is used over and over, you know, during one case. And then it just gets disposed of as you dispose of your drapes, right? Now, one thing for you to know, if the physician is asking for an oblique shot, and this is where the C-arm is going to be coming in at an angle, and it'll be coming in from, you know, the top or from the bottom, either one. In order for, you know, for you not to have excess C-armor, what you can do is I'm gonna pretend that it's coming in this way. What you'll do is go ahead and just undo the bottom and the middle and bring it out and leave this attached. So now that keeps it up, and now I've got my C-arm coming up here, and now they'll be able to take that oblique shot. All right, same thing, it comes down, and now we reattach. Any questions? Okay?
No, that's awesome.
Yeah,
Never
well,
seen anything like it. That's awesome.
It's just a simple drape.
no more 3/4 sheets.
Yeah, well, and that's the whole idea here, is to really, you don't have the wastage, you know, so, because it costs money for the hospital to throw things away. And also, it's just, you know, this is not as cost effective if you're only gonna go lateral like once or twice. But once you start going from AP to lateral multiple times, that's when this becomes very cost effective for a hospital.
And most of the hospitals have this product down here?
Most of them do. If they're doing spines or femoral fractures, that's really when it's used. Also, they can use it, podiatry will use it a lot.
Yeah.
Because they're doing multiple shots
Right.
on ankles and feet. Not so much the arms, although it could be used if they were, you know, if they needed to do something from an arm. But those are usually the mini C-arms that they're using for arms. So it's just not the same.
Thank you.
So, any questions about this? No? I'm gonna leave you one or two of these so that you can go ahead and have it, okay? So let's go ahead and